Hello, welcome. I am Cassandra Cassidy. I am a registered nurse and I hold a DNP degree. I am the founder and CEO of Nurses Mentoring Nurses. Nurses Mentoring Nurses is a nonprofit corporation dedicated to empowering nurses across all stages of their careers through mentorship, education, and professional development. The organization connects novice nurses with content from subject matter experts to enhance the understanding of real world clinical topics while also offering consulting services to experienced nurses seeking growth in diverse roles and settings. Its mission is to strengthen the nursing profession by fostering knowledge, confidence, and professional advancement. So, with us today, we have Julie Perry. Julie Perry is an assistant professor of nursing. She earned her nursing degree from Vanderbilt University and her PhD in 2018 from the University of Missouri. Her current scholarship is focused on improving health in the older adult population in the community setting. So, Julie, thank you for being here with us today.
Thank you for having me.
So, we're here today to talk about different types of nursing, variations of degrees, and subsequent credentialings or scopes of practice. So, I would like to ask you, Dr. Perry, to share with us some information. And so, I have a question for you here. Can you tell us about the types of degree options there are within the nursing profession?
Definitely. That's the one thing that's so amazing about nursing is there's a lot of avenues that you can get into nursing with. So you can start as a licensed practical nurse, an LPN. That nurse is going to be able to work in a skilled nursing facility at clinics. It typically is a 1 year degree. And then you have your registered nurse, and there's two tracks within that. There's an ASN, which is a 2 year program. And then there's a BSN, which is your Bachelor's of Science of Nursing. That's a 4 year program typically. And then even after that, they have what's called a Master's of Nursing program. And that's for folks that have a bachelor's degree in something else, but they want to go back to nursing and then they can become a master's of nursing. So those are the main tracks. After you get your bachelor's and your master's, you can become a master's prepared nurse, which is a nurse practitioner, a midwife, a registered certified nurse anesthetist. So there's lots of tracks. And the great thing about nursing is you can continue on. If you started as an LPN, then you can advance to an associate or you can advance to a registered nurse. So you always can continue your education even on to getting your DNP or your PhD level.
It really is amazing, the diversity that's offered for sure. Can you explain the difference in the scopes of practice between these different degree options?
Definitely. So your licensed practical nurse is going to be overseen by a registered nurse. They can do, it depends on your scope of practice in your state. So each state's going to have different scopes of practice, but your licensed professional nurse, your LPN, is going to be able to um, do medications. They're going to be able to do minimal assessments and care plans. Your registered nurse, either your associate degree or your BSN prepared, are going to be able to do care plans, pass all types of medications that are prescribed. And then your master's prepared nurse, if they are a nurse practitioner, a midwife, or a CRNA, are going to be able to prescribe and diagnose. But each state has different rules. So, for example, with a nurse practitioner, there are some states that have full practice authority, and then there are other states that still require a nurse practitioner to have oversight by a physician.
Hmm. What are some of the typical places that we might see different types of nursing practice?
Yeah, so that's the amazing thing about nursing is that you can work in so many different areas, right? So, if you're an LPN, there a lot of LPNs are in clinics or rehab hospitals or skilled nursing facilities. If you're a registered nurse, you can be in those places as well as in a hospital setting. If you're a master's prepared nurse, a nurse practitioner, you can have your own practice. You can work in a clinic. You can work in the hospital in all different areas. It really, the world is your oyster when it comes to nursing because you can even do businesses hire nurses. You could be a school nurse. You could work for an insurance company to help with, helping them decide, hey, is this something that a procedure that should happen or not? So there are so many avenues with nursing.
There really are. It is exciting to think about the opportunities that are available, particularly in the lower degree options, and that with the same education and skill set, how we can adjust and work proficiently in such a vast different areas. So it is.
I'm sorry to interrupt you. Those are great opportunities. If you don't have maybe the financial ability to go to a 4-year program right now, then start with a lower degree program and get your foot in the door. And a lot of companies will pay that tuition reimbursement for you to advance your degree. So, in continuing learning in nursing, nursing's changing all the time. So, continuing to learn and advance, whether that be through a master's that you become a nurse practitioner or you become a nurse educator, any of those are options. And so, I love nursing because it allows us to start where you can and then move up if you want to.
I feel the same way. I love being in the nursing profession. Well, those were my questions, Dr. Perry. I do want to thank you again for being with us today, and certainly Nurses Mentoring Nurses appreciates your time and that you shared with us today, but also that your knowledge that you shared with us, and helping us to have better insights into the nursing profession.
I encourage anybody to join and reach out because your association, your company is amazing to help other nurses thrive and grow wherever they may be.
Thank you.